The first thing I'm going to do is scan my room for the abdomen assessment. Okay, let me set my phone up. Okay, let's see. Jan, so you sat for me. Let me back up just a little bit. Should be good. Okay. All right, Mr. Henderson, my name is Candy. I'm a student nurse with USA School of Nursing, and I'm going to do an abdomen assessment on you. Is that okay with you? I'll wash my hands, have my pillow behind your head, and I need you to bend your knees for me. Probably should have took your shoes off for me. All right. So, the first thing I would have asked you is, did you empty your bladder?
Yes.
Okay, so you don't have to empty your bladder. So I got you to bend your knees, arms straight beside your in your head, pillow under your head. All right, the first thing I'm going to do is I'm going to look at your skin. Your skin is even toned. I don't see any hernias. I don't see any scars. There's minimal hair on your chest, on your abdomen. Um, your your contour is rounded. I'm going to look at your umbilical. Your umbilical is midline and it's inverted. I don't see any hernia. I don't see any masses. I'm going to look at your aorta. And I'm going to say that's for your pulsation. I don't see any peristalsis. Okay? The next thing I'm going to do is I'm going to auscultate with my stethoscope. I'm going to use the diaphragm of the stethoscope. And I'm going to listen for, you have 4 quadrants. You have your right upper, right lower, left upper, and left lower. And I'm going to listen for your bowel sounds, okay? Okay, your bowel sounds, they were normal in all 4 quadrants. When your bowel sounds are normal in all 4 quadrants, it's a high pitch gurgling sound that you hear, and you would get 50 to 30, I would hear 50 to 30 sounds per minute. Okay, so if your bowel sounds were hyperactive, it would be a loud high pitch, and there would be more frequently, so I would hear more than 30 per minute. And if they were hypoactive, it would be not as loud. They wouldn't be as frequent. It would be less than 5. It would be more quiet, less than 5 times per minute. Now, if I did not hear bowel sounds at all, then I would listen in your right left quadrant for at least 5 minutes, okay, to do that. So your bowel sounds are there, everything sounds fine with that. So now I'm going to listen for your arteries, and I'm going to use the bell of my stethoscope to listen to your arteries. You have your aortic artery, you have your renal artery, and you have your iliac artery. And I'm going to listen for, what I'm listening for is for Bruins, okay? So we're going to listen for your aortic. I'm going to listen for your renal. And your iliac. Okay. I'm going to grab my paddle quick. All right, and so the next thing I'm going to do is percussion, and I'm looking for timpani, okay? So with the right side of my paddle, I'm going to place my fingers here, and I'm going to press, okay? I want to make sure they can see. All right. So there's no abnormal signs there. Now the next thing I'm going to do is I'm going to do palpation with my hands. I'm going to do 3 different types. I'm going to check for light pressure, and this is going to check for your muscle tone and your surface. So if just let me know if you feel any tenderness, okay? All right. Any tenderness there? Mm. All right, the next one is going to be checking for masses, and I'm going to do deep pressure, okay? So just let me know if you feel any tenderness there. Any tenderness there? Yeah. All right. The next thing I'm going to do is I'm going to check for your check your liver, okay? So if you can take your hand and hold your hand back here for me. Is that okay? Mm-hmm. All right, and I'm going to place my hand underneath your back, okay? And I want you to take a deep breath, hold it in, and exhale. A deep breath, hold it in, exhale. And a deep breath, hold it in, and exhale. All right. And then if I wanted to check a different way, I can grab right here, and I feel right here where this rib bone is, but your liver, everything feels fine there. So the other thing I'm going to do is check for your spleen, which is on the other side. So I'm going to place my hand over here, and I'm going to press over here. All right, and I did not feel your spleen, so that's normal, okay? The last thing I'm going to do is I'm going to check your kidneys for CBA. So if you can sit up for me, and maybe it may be uncomfortable, but sit up and turn that way for me. All right, and what I'm going to do is I'm going in between your 11th and 12th ribs, and I'm going to press on it. I'm going to place hands, and I'm going to strike it with my hand, and I want you to tell me if you feel any pain or tenderness, okay? Anything there? Mm-hmm. All right, and so that shows that there was no your kidneys didn't show any CVA for tenderness, and that concludes your abdominal assessment. You can sit back, and I'm going to scan the room. All right, thank you.